The main point here is that risk management should be considered a business process. And like every business process, we should know when it's working well and when it's not working well. And we should know that quickly so that we can course correct. We should not have to wait until the end of the year or maybe a market event to happen to tell us that we are not doing well, right? That would not be very productive. So we should have a system in place that helps us to see that we are making progress, we are being effective. Well, hello everyone, and I'm so excited to be back with you again. It's Tuesday, and every Tuesday at this time, we get together and talk about risk management related topics. So I'm excited once again to welcome you to this live discussion. If this is your first time joining, welcome. We talk about risk management topics at a high level. So these conversations are not a lecture. The purpose here is not to teach you something that I think is right or the way it should be done, but rather to have a conversation about big topics. Many of you have come back, so I welcome you. And I look forward to having a conversation today with you on a topic I've been thinking about for a long time. And that relates to the effectiveness of the risk management process. So we'll talk a little bit more about that, but as you are settling down, know that we are recording this session. So this is a public forum. Please do not share any proprietary or business sensitive information. But I want you to engage, and you can engage through the Q&A at any time. It doesn't have to be a question. You can share a comment, an opinion, an insight, because I know all of you have a lot of experience as well. So I look forward to hearing from you. Just know that it is a public forum. And also, whatever we discuss in these sessions should not be taken as regulatory advice. That is not our purpose. Our purpose is not to talk about what is regulatory compliance, what is acceptable to regulatory authorities or not. We do go into requirements a lot, and we talk about what are some of the good ways to meet those requirements. But it is not to be taken as regulatory advice. And typically what we do is that we go through a couple of slides about the topic, but really engage in a lot of Q&A. So the more you share in the Q&A, the better it will be for our conversation. So let's talk about effectiveness of risk management and why it is important. Right now, you might be in a leadership position responsible for risk management, or you might be an individual team member involved in risk management. From both that perspective, it's important to know how well we are doing, right? And how well we are doing is related to effectiveness of the process. So in my mind, risk management is really a business process. And like every other business process, we should know when it's working and when it is not. So we'll talk a lot more about that. And today what I want to discuss with you is really a framework that you can use to establish some criteria for effectiveness. I don't have a checklist for you. So if you're looking for that, you're going to be disappointed. But I'm going to talk about a framework that can help us maybe develop some criteria by which we can help our organizations measure effectiveness, because it is very, very important. Now, as you are settling down, let me also tell you that I would like to know about you as well. So I'm going to be asking you to share your opinion in a couple of poll questions. And in fact, the first one I want to launch right now, so I know where are you joining from, what is your role. So please let me know a little bit about yourself in this poll, and throughout our conversation we might ask a few other questions just to see what you are involved in and what are some of your challenges. So as I was saying before, risk management is a business process. It should be treated as a business process, right? We invest a lot of resources in risk management, so we should know how well the process is working. Now, unfortunately, actually it's my experience that unfortunately we know when it's not working. And usually we get to know it's not working when things are really bad. Let's say, for example, we have a very severe adverse event in the field. And as a result, we have to recall a lot of product. People start to think about risk management process. What is not working? Maybe we have continued problems, malfunctions in the field, and as a result, FDA is knocking at our door. Maybe they are giving us a warning letter. Now that will be a very extreme situation, but it happens. Or we find ourselves in an audit where we get a lot of audit findings on our risk management process. So generally we get to know when it's not working. But I think it's too late, right? That's true, correct? It's too late. We need to know when it's working and how well it is working. Are we on the right track? Are we making progress towards the goals that we have established for ourselves? How would we know that we are staying off track? So we're going to talk about all of that today within this framework. So I want us to engage a lot. In fact, as I mentioned, I've been thinking about this for quite a while. And we talked about this topic a few weeks ago in these live discussions. I had done a LinkedIn poll and I shared the results of that poll and invited some conversation. And a very insightful comment was shared at that time that typically the management's approach to effectiveness of risk management is more implicit. It's not very formal, but I would love to hear from you what it is like in your organization, whether you have a formal approach or not. Okay, so thank you for participating in this poll. I can see a lot of you have come back. In fact, all of you are back here. So I'm so happy to hear that from you. Thank you for coming back. I hope you continue to get value out of these conversations. A lot of you are involved in risk management, quality engineering, and regulatory affairs, R&D, independent consulting. So we do have a very diverse group and diverse perspectives. And in fact, it's great because risk management is truly a cross-functional activity. So we're going to talk about what effectiveness means for risk management. And if you would like, what I would like to hear from you is your perspective. And if you feel more comfortable talking to me one-on-one, I'll share with you a link at the end of the session today where you can schedule a 30-minute chat. No strings attached. Just let's get to know each other, share ideas, connect and collaborate. So you are able to do that. But I really want to involve you in this conversation because we can jointly develop a framework that could be meaningful to a lot of people. So that is the goal. So let me go through a couple of slides with you, only a couple of slides. And again, it's a point of conversation. Anytime, please share your question or comment in the Q&A box or simply raise your hand if you have something to share. So the question number one is, what is effectiveness? What does that mean? So that's what I do. I basically pay a lot of attention to terminology and I go look up the dictionary. And I looked up the dictionary in a couple of places. And what came out to me is people are looking at effectiveness more or less in this way: the degree to which something is successful in producing a desired result. So it seems to have two components. It's a measure of success, and the second is against some desired result. So it has two parts. We need to know both. So what is the desired result and for who? That means first we must clearly understand the expectations of our stakeholders. And we have many stakeholders, right? We have internal stakeholders and we have external stakeholders. A lot of time we spend with our internal stakeholders managing the expectations because risk management is truly a cross-functional activity. And the functional heads of each department who invest resources in our process are one of our stakeholders, right? So here's the next question that I would like you to share your opinion with me is, who has the primary responsibility for risk management in your organization? Please let me know what your organizational situation is because I want to tailor my conversation today based on the environment you are operating. So let me know who does the risk management function in your organization, who is primarily responsible, because then we can understand who the stakeholders are. Right? So we must clearly understand the expectations of our stakeholders. Now, again, I ran a poll on LinkedIn to really gather some feedback about what people would consider as an indicator of effectiveness. Okay, so I asked this question: which of the following would you consider to be the best indicator of the effectiveness of your current risk management process? And I gave them 4 options. LinkedIn allows me only 4 choices, no more than 4. Reduced time to market, no audit findings, fewer adverse events, and patient doctor satisfaction. I gave them just these 4 choices and say, which would you consider as your best indicator? Because I wanted to see what people think of as an output when they think of risk management in general. So the results were very consistent with a similar poll I had done in the past. 4% of the respondents said reduce time to market, another 4% no audit finding. Majority of them said fewer adverse events, 72%. And a fair amount of people said patient doctor satisfaction. I got about 123 people to vote in about 2 days. The poll is still open, so you are welcome to go and express your opinion in this poll. But the results are consistent with what I had seen before. In general, people are expecting risk management to deliver these goals: fewer adverse events and patient doctor satisfaction. The question to wonder about is that primarily the purpose of only risk management or the whole organization? And there are many other functions, many other business processes involved. So to what extent do we expect risk management to deliver this? Here is, I wanted to share with you what you have answered in the poll. Some of you have dedicated risk management function. Some of you have a shared situation where this is led by R&D. But primarily, it seems like it's shared and led by quality regulatory. In one case, it is shared by medical safety, medical affairs, which is good news because I think medical safety, medical affairs has a big stake in safety risk management. But it is similar to my experience as well that in large organizations, now they may have many different business units. So we're not talking about that at the enterprise level. At the enterprise level, you might have a dedicated risk management function, but really at the individual business unit level, this work is done by quality and regulatory in most cases. In many organizations, R&D seems to do everything, especially which are early stage, small to mid-size organizations. They're responsible for everything. So it is very consistent with my experience as well. So I'm going to frame my conversation mostly around the quality regulatory perspective. So if you are part of the risk management team and working in the quality regulatory function, your primary stakeholder would be the quality regulatory leadership, right? And you have to look at what their expectations are. They have many other processes, many other business processes as part of the quality function and regulatory function. Risk management is one of it. What are their expectations? How are they measuring success of the risk management as a whole and you as an individual? Both are important. We're going to focus on both of those points. So thank you for answering that question in the poll. Now, when I looked at this information, this result, which was very consistent with the last time I ran this poll, pretty much same. This image came to mind. So these are big goals. We want to climb that peak. We want to achieve a big result. But are we doing it just by risk management? Or are we doing it with some other tools in our toolkit as well? To what extent the output of risk management is directly linked to these big goals is what we have to think about in this framework. Because if we just limit our effectiveness criteria to these big goals, we would not know as quickly as we would like to whether we are on track or not. Because many times this line of sight is not very clear. We don't know where the big goal is. And sometimes we just stumble and say, hey, we are so much off track, we got to do something about it. We are more reactive. That's when we know things are not working. So I want to share with you, please continue to share your questions or comments because this is going to be a pretty open-ended conversation today. Not a recipe, not a formula, not a checklist. So Mitch Finney shared this comment with us on LinkedIn, which I felt was very, very insightful. The answer I would like to give is missing. No unexpected hazards or harms and occurrences within expected. That's what he would have liked to see as a choice, is that no unexpected hazards or harms or occurrences are within expected are some of the choices that he would like to see if the risk management process is effective or not. But of course, I did not provide that choice. But he's very insightful in sharing this with us. Because what he's saying is that the fewer adverse events does not mean you have necessarily a good risk management. It is not a simple cause and effect, right? It's not a single variable output in a technical terms. Fewer adverse events depend on a variety of things. It may mean that you have a very robust design for the use conditions. We are not making too many mistakes. Product is performing at high reliability. So in general, our rate of adverse event is low, which seems to be the case with a majority of medical devices, which is good news. But still, we have a lot of serious adverse events going on, right? So how do we dig into that? So Mitch is saying that an example would be lower AEs, which is adverse events, but a few unexpected very severe events. This would not be a sign of robust risk management, even though AE count is low. Good risk management and robust designs are complementary. Yes, good risk management will facilitate good design, and good design will help us accomplish these big goals. So we are all in it together. It's not a single linear line, and that is why we should not be looking at these big goals as a measurement criteria or the effectiveness criteria, because we would not be very accurate in our assessment. We would not know if when we achieve a good result, is it because our process is really good or something else is going on? Or if we get a bad result, is it because of our process or something else? When we have a recall, we talk about many different things, but risk management is also primarily featured in that conversation. Something is missing in our process, right? That's when we get to know. But these are the big events. So what can we do better? What would be a good framework for us to think about to see how well our risk management process is doing? So for that, colleagues, I will actually go to ISO 14971. And this is something I have read more than 100 times now. And every time I read, I learn something new. In clause 4.1, the very first line, actually I have the standard with me here. It says the manufacturer shall establish, implement, document, and maintain an ongoing process for. That one word, the first line of clause 4.1, that one word for at the end of the statement actually tells me what the standard considers to be as the main purpose of risk management process. I think there's a clue there. So let me share with you, and I cover this in my live training course with people in a lot of detail, because it allows us to focus, and that's what I want to share with you. Our first purpose is to identify hazards and hazardous situations. That's what the standard tells us. That's the reason why we do risk management. The second purpose is to estimate and evaluate the risk levels and acceptability. Third purpose is to identify and implement risk control measures. And the fourth purpose is to monitor the effectiveness of those risk control measures. And this has to happen across the entire life cycle. So I want us to now understand this standard in a very different way. This is not about compliance. The very first line in clause 4 is all about purpose. And if we understand that well, I think we can understand effectiveness. So how do we go about this, right? We ask a few questions. The first question we ask is, how well do we identify hazards and hazardous situations associated with our medical devices? How well, right? So it's an open-ended question. And the first recommendation I would make to you is, if you are involved in risk management or you have ownership or responsibility for risk management, schedule a 30-minute meeting with your stakeholders and ask them this question: what is their view and perspective on risk management? A very open-ended question. And as the conversation develops, you understand where they are coming from, what it is that they want. And then you start asking these pointed questions. So how well do you think we are doing in identification of hazards and hazardous situations associated with our medical devices? Open-ended question. And people will have a different standard to answer that question, and you take all that input as you can. Then you develop more formal methods to gather information about that. How well are we doing? So I like to keep these questions open-ended in the framework to gather stakeholder feedback and then build an appropriate tool that we can run very frequently. Second question, again going to the standard, is how well do we estimate and evaluate risks associated with our medical devices? One of the components of how well in this area could be how accurate are we? How good are we? Our estimates, are they too conservative? or not accurate enough? And how would we know? We would know based on our post-market information. If we are ultra conservative in our estimates, we are not doing any good to our business, not doing any good to our patients and doctors, because most likely we will over-engineer the device. And if we are not very accurate, if we are underestimating, which actually is beginning to be realized by many regulatory authorities, there's a warning letter from the FDA, couple of warning letters, which are actually hinting at their thinking right now. Their current perception seems to me that we are underestimating risks, which is not a good sign, which means that we are probably not implementing the controls that we should. So how well, one of the components would be, how close are we to the truth, right? The third one is, again, how well do we identify and implement risk control measures? How well do we do this job? Are we complete? Are we as good as the state of the art or better? What are the criteria by which we evaluate the effectiveness of our risk control measures? So here are the clues. When we ask these questions, we can pursue these clues to figure out if we are doing a good job or not. And these can be measured more frequently than the overall goal of fewer adverse events, or let's say no warning letters, or let's say patient doctor satisfaction. If your marketing department is doing patient doctor satisfaction surveys, maybe you collaborate with them and gather information about their experience with the device itself in terms of potentially problems that they face, malfunctions that they face. Are they easy to handle? What is their perspective? Maybe design a survey so you can get that information back and link it back to your activities in risk management. So in terms of controls, how well do we identify and implement risk control measures? And finally, I believe the most important measure is ongoing measure. How well do we monitor the effectiveness of our risk control measures and take appropriate timely action when needed? Again, a very broad, open-ended question. How well are we doing it? And who are you going to ask? You're going to ask your internal stakeholders first, because they would know. And in doing so, you will also learn what their expectations are from the risk management process. And you'll be able to precisely define some criteria of effectiveness against those measures. So I hope this provides you with a framework, and the clue really is in ISO 14971. First line in clause 4.1 is all about the purpose in my mind. That's how I look at it. So would love to hear from what your view is, what your perspective is, and see how we can together get some more clarity around this framework. This is what I would like to do in the coming weeks and months, continue to have this conversation, because I believe we are missing a huge opportunity in risk management and effectiveness because we don't have a formal structured process of figuring out how well we are doing on an ongoing basis. And I also believe, I feel that it affects individuals who are involved in risk management also. Because if no one knows how well the process is working, you probably have a hard time explaining to people what you do, what and how it links to the business goals, and tell people when you do a good job, and have them realize that you have done a good job if you don't have a formal structured process, right? Another way of looking at this would be really pre-market versus post-market. I think that you should probably evaluate the effectiveness a little bit differently for a product which is under development versus a product which is already in the market, and the maturity level of those products. Because the purpose of risk management in these two phases of the life cycle could be quite different. The kind of activities you would be required to do could be different. So it may be worthwhile to consider a different effectiveness criteria, maybe similar in the overall bucket, but a slightly different effectiveness criteria for design and development, and a different set of criteria for post-market. That's just a thought I have, and I would again love to hear more from you. So guys, I want to close by just summarizing. I don't see any questions or comments. I don't know if I lost all of you or not. No, you are still here. You are still here, so I haven't lost you. I hope you find value in these conversations. Please let me know your thoughts, your insights, your questions. Reach out anytime on LinkedIn. schedule that 30-minute conversation that I was talking about, and I'll give you a way to do that in just a minute. So let me just recap. The main point here is that risk management should be considered a business process. And like every business process, we should know when it's working well and when it's not working well. And we should know that quickly so that we can course correct. We should not have to wait until the end of the year or maybe a market event to happen to tell us that we are not doing well, right? That would not be very productive. So we should have a system in place that helps us to see that we are making progress, we are being effective. So the framework we develop should give us that piece of information much more quickly, right? I shared with you that consider a maybe slightly different set of criteria for design and development phase versus post-market phase. Maybe treat highly sophisticated, complex new products slightly differently than more mature products on which you have a lot of market experience. So you can balance it. You can balance pre-market and post-market focus and measurement differently because these are really two different phases. And I know we pay a lot of attention in design and development. I'm not sure we pay as much attention post-market. So that will be one area for you to consider and maybe prioritize a little bit more when it comes to effectiveness. So those are the main key points, guys. We are almost at the end of our time today, which is 12:30. I'm just looking at my watch here. So thank you again for joining. Let's keep the conversation going. Engage with me on LinkedIn, drop a note. And here is a couple of free resources that I always share with you. Maybe you have seen it before, so it'll be a recap for you. But what you can do is really book a 30-minute conversation with me, no strings attached. The whole idea is to connect, collaborate, and share ideas and challenges. I'm not tied to anybody. I'm an independent person. So what you will hear from me is truly an independent opinion, and my interest here is to mostly connect and collaborate with you. With that, I want to thank all of you for attending again. You might get a quick one-question survey at the end of this session today, asking your ideas about questions or topics for our future discussions. Because my purpose here is to focus on your questions and comments and your challenges. Please reach out to me in any way that is comfortable to you, that makes you feel comfortable, because the purpose here is for us to learn together, learn collectively, and help each other out in the industry. We want to elevate our collective capability in risk management. With that, thank you again. Everybody, have a good week ahead, and I look forward to seeing you again next week.